There are countless complications associated with postoperative nausea and vomiting, including aspiration, wound dehiscence, esophageal rupture, electrolyte imbalance, dehydration, extended recovery time, and elevated cost. In the general postoperative stage, 30% of patients vomit and 50% of patients have nausea. High-risk patients may have an increased risk up to 70 to 80% for postoperative nausea and vomiting. The purpose of our education plan was to educate nurses caring for postoperative patients about the benefits of using ginger and peppermint to decrease the incidence of postoperative nausea and vomiting. Our PICO question was, among postoperative care nurses who receive education on peppermint and ginger for postoperative nausea and vomiting, compared to those who have not yet received education, is there an improvement of knowledge? Our research consisted of the database CINAHL. Our search parameters were peer-reviewed articles dating between 2013 to 2020. Our keywords used for our research were peppermint, postoperative, ginger, nausea and vomiting, aromatherapy, and alternative therapy. The current evidence that supports our education research project was in comparative studies on postoperative nausea and vomiting interventions that one study showed ginger had a markedly lower nausea and vomiting score within the first 2 hours post-procedure than a common drug given for postoperative nausea and vomiting. Patients that used peppermint and aromatherapy upon arrival to the PACU experienced a decrease in the severity of their nausea. Some even declined medications and solely used the peppermint. In another study, it was found that 500 milligrams of oral ginger given 1 hour before surgery in women who were undergoing laparoscopic cholecystectomy is effective in decreasing severity of postoperative nausea and vomiting. For additional studies to review, look in our references.
For our learning objectives were to comprehend the complications associated with postoperative nausea and vomiting, reflect on current practice recommendations and literature, identify ginger and peppermint as ways to treat or manage postoperative nausea and vomiting, understand the effects peppermint and ginger have on the body and why they would be contraindicated. Our location and target population included registered nurses at UC Health Westchester Hospital, PACU, and Mercy Fairfield Hospital Family Birthing Unit. We gave the information via a handout binder on the units and sent out an education PowerPoint via staff email. We allowed for self-paced review of materials at convenient times and looked for the effectiveness of education via pre- and post surveys. We had 7 statements rated on a scale of 1 to 10. 1 represented strongly disagreed or no knowledge, and 10 represented strongly agreed or complete knowledge. I have a clear understanding of the complications that can arise from postoperative nausea and vomiting in my patients. I comprehend the current practice recommendations regarding managing postoperative nausea and vomiting with peppermint and ginger. I can identify patients at risk for postoperative nausea and vomiting. I would identify ginger aromatherapy as a way to reduce postoperative nausea and vomiting. I would identify peppermint aromatherapy as a way to reduce postoperative nausea and vomiting. I would identify pre-op oral ginger supplements as a way to reduce postoperative nausea and vomiting. And only on the post-test we included this information on the presentation was useful to me in my practice as a professional nurse. Our chart results are on the side there, but overall the nurses that received the education had an improvement in scores. The pre-survey scores on statements 1, 3, and 5 showed high levels of prior knowledge. The statements that had the greatest increase in scores were statements 4 and 6, and both statements pertain to knowledge of using ginger to reduce postoperative nausea and vomiting via oral supplements and aromatherapy. Overall, we learned from this project that in-person presentation of education could have better facilitated feedback and participation. Comparing survey results across units in the future could help identify knowledge gaps in different nurse populations. And further education strategies may be focused more specifically on implementing ginger to reduce postoperative nausea and vomiting. And here are our references.
Thank you.